Thank you for having me.
Dr. Taya, beg your pardon. How dare me not call you doctor? How are you?
I'm fine, thank you.
Okay, there's so many questions in my head right now, but the first one I must ask is, what made you go into plastic surgery? Because I don't find people within Nigeria. I know pediatricians, I know general practitioners, I know gynaes. We don't come across people like you every now and then. But yes, what exactly drove you into this part of medicine?
That's a tricky one. Let me start by saying that I actually didn't know I was going to end up in plastic surgery.
Okay.
For me, it was the desire to be a surgeon that came first. Okay. And then during the course of my training as a surgeon, I figured that plastic surgery was a good place to settle in. Funny enough, there are quite a number of us around.
Okay.
Give or take, we should have about 150 plastic surgeons in the country.
In Nigeria? Just about 150?
Yes, just about 150. Plus or minus 20.
So you guys are kind of scarce. That means you'll be in demand.
Yes and no.
Okay.
Because plastic surgery is actually a specialty, or it's a specialized field.
Yeah.
You have the general practitioners, first of all, before they are the ones that see patients, and then they refer to the specialists. So it's a form of bottom-up referral system of approach. So I think that would explain it.
Okay, so let's delve deeper into the world of a plastic surgeon. Okay. How does one even first and foremost become a plastic surgeon? I know you definitely have to go to med school.
Yes.
So after med school, that's where my information, my knowledge stops. So what happens next? And I need to know if maybe I could think about
pursuing a career in plastic surgery. So first you have to become a doctor, like you rightly pointed out. Okay. After which you have to do your national youth service. If you're in a place like Nigeria. Okay. Following which you would have to write a couple of exams to qualify to enter into a residency training program in surgery. Okay. You would probably have to do general surgery for 3 to 4 years. I think the current guidelines state you have to do general surgery for about 4 years before you then specialize in plastic surgery as a subspecialty. That would take an additional 3 to 4 years of training. So all in all, you'll spend about 8 to 10 years post your graduation as a doctor to train to become a plastic surgeon here in Nigeria. Of course, the rules differ in other parts of the world. Okay. I think the UK, you spend an average of 5 to 7 years. The US, about 6 to 8 years. So this is the Nigerian situation. Wow.
Okay, so after I did a little bit of research, I won't call it research, but I was delving just a little, I realized that it's not all about the cosmetic part of surgery, but that's the most we know. I wanted to ask you first, how did Hollywood budge, for example, influence you becoming a plastic surgeon?
Well, to be honest, by the time I was going into plastic surgery as a specialty, I don't think botched was on our screens.
Okay, okay.
I'd heard about 90210 and a couple of other shows, but for me, it was more of seeking a balance between career satisfaction and having a personal life.
Oh,
yeah.
Okay.
And then also, you also have to think about how you would influence your patient's level of satisfaction.
Okay.
And I found that plastic surgery has a relatively higher patient satisfaction rate when compared to a couple of other specialties.
Oh.
Yeah, so that was basically what influenced me going into plastic surgery.
Okay. Well, if you ask me, I would say that plastic surgery is broken down into the expedient part of it, and then the desirous part of it. And by saying desirous part, you already know what I'm talking about. So, but in your terms and in your knowledge of it, can you help us just break it down? What exactly are the parts that are under the umbrella of being
plastic surgery?
Of plastic surgery.
Broadly, we would say plastic surgery is a combination of both reconstructive surgery, which is what you call the expedient part, and then there's the cosmetic surgery aspects, which is the desirable aspects that we talked about. For the most part, here in Nigeria, most of the plastic surgeons that actually practice more of reconstructive than the aesthetic or the cosmetic aspect of surgery. And broadly, we would then subdivide reconstructive surgery into the different regions of the body, and then also into the level of skill or expertise that is required to solve these problems. Case in point would be a child that has cleft lip and palate. That will come under craniofacial plastic surgery. So basically, this would be a plastic surgeon that has special interest in surgeries of the head and neck only. We could also, under reconstructive surgery, have a subspecialty of trunk and extremity surgeries. So basically, patients that have road traffic accidents, have leg ulcers, have defects of the leg in which the bone is exposed, complex defects basically of the extremities that require expert care. Patients that have tendon injuries, nerve injuries, and then also soft tissue defects that require resurfacing, that will come under trunk and extremity surgeries. Then some people will broadly also talk about an aspect of plastic surgery that is called reconstructive microsurgery. And basically this is the harvest of components of tissue from one part of the body, and then they are transported to another part of the body, and then using microsurgical and anastomotic techniques to reconnect blood vessels, that's arteries and veins, and then even nerves to tissues in the recipient aspect of the recipient site. That's talking about reconstructive surgery in brief. For the cosmetic surgery aspects, we'll talk about the different regions of the body also. So for head and neck, we'll talk about procedures like the face lifts, Botox, the neck lift, the chin lift, the brow lift, and the likes. Going to the trunk, we'll talk about the tummy tuck. We'll talk about breast surgeries. We're talking about breast reductions, augmentations, and the likes. And then also going into the trunk, we'll talk about liposuction, body contouring, and then fat transfer also. So fat transfer, fat grafting, and things like that in brief.
So when clients come to you for the cosmetic part of surgery, when they come to you, what is their primary reason for what they do? Let's get into the psychology of the clients who desire to do these. What do they tell you? And I know, don't tell me there are no client, patient privileges or what have you. But what is in the mind of someone who wants to reconstruct out of a desire to change what they look like?
That's a tricky one. I'm not a psychologist, so it'll be a little difficult for me to talk about the psychology of these patients. But what I would say is the majority of these patients actually have genuine needs. I can talk about a woman who has had 4 children and has had a tummy that needs to be tightened. So this woman basically has a desire to have her flat tummy back. And the reasons span from just the deposition of fats in the anterior abdominal wall to the fact that she might have the muscles that should keep the tone of the anterior abdominal wall firm and together. Due to the multiple pregnancies, it could be a little flabby and require a little bit of tightening. Some of them could have coexisting hernias, and these will have to be tackled in the same sitting. some of them actually have chronic abdominal pain due to maybe a nerve impinging on something, amongst the myriad of reasons, basically. So there are a whole lot of reasons why people come for cosmetic surgery, like you say, and the reasons can actually span from reconstructive reasons to aesthetic reasons.
So whoever said women who are big or big in size were not acceptable, but right now everybody wants to have a more lithe physique, more and nobody wants to pay the price of going to the gym nowadays. So they think coming to people like you will just solve the entire situation, and voila, they have that figure. And
I would be careful with saying nobody wants to pay the price, because actually a large subset of my patients, even if they went to the gym every day for 1,000 years, will still not be able to get their dream bodies.
Wow.
And the only solution to these issues requires the skilled hands of a plastic surgeon. I just give you one example. Another example that comes to mind will be somebody that has congenital abnormalities. Somebody comes small breasts or uneven breasts, and then she walks around, people laugh at her. Would you say her reasons for seeking plastic surgery are not genuine? Or somebody that has had a mastectomy following breast cancer, and she doesn't have any breasts anymore, and she wants the regular busts that guys and even women look at and say that there goes a woman. Are you saying that her reasons for seeking plastic surgery are not genuine? So people have a long list of reasons. And then there's the subset of patients that have the money and have the desire to have a bigger bust or a bigger behind or a flatter tummy.
Oh, wow. So
there's a whole list of reasons why people seek for plastic surgery, actually. And I like to say that the reasons are tailored to the patients that present.
Okay, so how available are these facilities? Or I know doctors generally are they are getting scarcer, let me use the word, by the day.
Yes. Actually, if you look at the World Health Organization release talking about the doctor to patient ratio, Nigeria is actually way behind when compared to what is actually obtainable or what should be obtainable. But that's by no means does not change the fact that the services of plastic surgery are actually available here in Nigeria. In Lagos, for instance, I can think of at least 10 plastic surgeons off the top of my head.
And they have everything they need here to attend to any patient?
Yes.
Wow.
Yes. Services are available, equipment
are available. How affordable are these?
Now, affordability is a function of the patients. If you're talking about reconstructive plastic surgery, the good thing is health insurance actually covers for some of these procedures, majority of these procedures actually. But if you're talking about the aesthetic or the cosmetic aspect of plastic surgery, usually these patients pay out of pocket. And you will agree with me that a patient that is looking to alter an aspect of her body, his or her body, because of desire, usually can afford to pay for these things. It's not an emergency, so patients can actually plan for these procedures and then pay for these procedures when they are ready or when they can afford it. The indication for reconstructive surgery is usually very clear, both to the doctor and the patients. A patient with a cleft lip and palate usually will want you to do the surgery as quickly as possible, because they don't want to go around on the streets and have people pointing at them. A patient that has an open wound to the leg will think about that wound in terms of loss of man hours. If the person is a laborer, for instance, that patient will probably not be able to go to work. If you're lifting loads, carrying objects, moving up and down, it usually will increase the mobility basically of that wound. And as a result of this, these patients generally want you to do the surgeries for them as quickly and as quickly as possible, basically.
What is the duration of a time with you? How long would one be under your knife if someone is coming for cosmetic surgery?
That's a tricky one because no two procedures are the same.
Okay.
The duration of surgery is usually a function of the indication of the surgery. So a patient that is to undergo a simple skin grafting procedure, depending on the size of the defect that needs to be resurfaced, can be under the knife for an average of 45 minutes to 1 hour. But if a patient is to undergo a bilateral breast reduction surgery, I would expect the patient will be under the knife for upwards of 4 to 6 hours or even more, depending.
So when they come to meet you for this surgery thing, and we've talked about how affordable they could be, but are there other kind of connections to, say you guys do a test and you see that, okay, there are some other things that they need to attend to before they could do things like this?
Yes.
Does it make it complicated? And is there a once visit to your place, or once you come to see you, they have to keep coming to see you just to maintain what they came to fix?
Now, that is also a function of the type of procedure that has been done. If a patient undergoes a breast implant surgery for breast augmentation, for instance, as long as there are no untoward complications, such as rupture of the implants due to a myriad of reasons, patient can have it for as long as she wants, as long as there are no complications. So I would say the number of visits would probably be the preoperative visits leading up to the surgery, the initial post-operative period to ensure that wound healing has taken place and there are no untoward complications in the immediate post-op period. Follow-up visits are a function of patient's complaints or patient's need to have further procedures done. For instance, somebody that has undergone a procedure to augment her breast from possibly an A cup to a B cup breast.
That's an enlargement?
Yes, a breast augmentation is basically an enlargement of the breast. She might suddenly decide after a while that she wants to go bigger or she wants to go smaller. It's a function of what she wants. And what we are here to do basically is to work with what the patient wants within reason. So for such a patient, we will then have to undergo some revision procedures. I should also talk about the fact that there is the possibility that even after an initial procedure, there might be need for subsequent minor revisions post the initial procedure to optimize the patient's satisfaction. So that will also generate the indication for subsequent visits.
Are there any men coming to
do definitely
cosmetic surgery?
Yes, most definitely.
What do they come to fix?
In my practice, the most common reason I have seen men present for is actually for a breast reduction.
Men?
Yes. Men actually do have breasts. It might be more vestigial than and less visible than that of women. But in a certain subset of men, they might have breasts that are prominent. And because of the obvious embarrassment that comes along with having such features, they usually want that sorted out. Another reason men present would be the male patterned baldness. They want something to resurface the lost hair over their scalp. And then some men actually come looking for a tummy talk.
Okay.
You're looking like you might want to visit me.
Yeah, no problem. If
in the not too distant future.
I'll rather gym this one. I'll burn it out.
But all of this is talking about the aesthetic part of surgery or plastic surgery. For the reconstructive aspect of plastic surgery.
Somebody, I have to cut you. My cameraman must visit you. Actually, let's go.
Yeah, you can give him my number. But yes, talking about the reconstructive aspect of plastic surgery, it's actually been found out that men are more prone to accidents. And as a result, trauma-related indications for plastic surgery is usually more populated with men than women. Okay. So we have both men, women, and children visit the plastic surgeon.
Wow. Dr. Ayo, thank you for coming.
That's my pleasure.
Again. Yeah.